Everything is gone. Come back here again. Phase 3, if becomes low, which drug I am using here? Class 3, okay? If phase 0 becomes low, you can see phase 3 is very fast, rapidly going down. Phase 0, you can see the very big difference between these two. Yeah? But the end result, can you see end result is the same? Time is increased. Yeah? Time is increased. So action potential duration is increased also here. Action potential duration increase also here. Understand? Action potential duration also increase here. But what the problem here? Here and here, what the main difference? If the phase 3 become very prolonged, the current stay for more longer duration. Yeah, current stay for more longer duration. If here action potential duration become lengthy, current not stay for longer duration, current now become more slow to develop. Okay, more slow to develop. The problem with the class 3, the important thing, if you decrease the activity of the potassium channel, the again myocardium, if you remember how myocardium repolarize, the myocardium first will depolarize from inside, the inside to outside. Okay, from here the current is moving, depolarization, 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 depolarization. Yeah, the outside become negative, outside become negative. When repolarization start from epicardium, the epicardium outside now start becoming positive. So repolarization start. If this repolarization become very slow, that's your phase 3. If this phase 3 become slow, so what happened? The repolarized tissue again start depolarization. Oh, repolarization now again start depolarization. What happened with the ECG? If the phase 3 become very slow, in the phase 3 the QT interval become prolonged. QT interval become prolonged. If QT interval become prolonged, what happened? This person may develop torsade D point or life-threatening arrhythmia. So that's an important side effect of class 3. Class 3 doing what? Class 3, they make your depolarization and repolarization more slow. So what happened in the ECG? You can see the ECG here. QRST, if you remember this thing, this your T is your repolarization actually start from this segment, okay? This is your TST segment, this is your T wave. So this part is your potassium, under control of potassium channel. Okay, under control of potassium channel. This your depolarization under control of sodium channel. Understand? The drug of your sodium blocker, they can decrease this activity, and the potassium blocker, what they're doing, because they block the potassium channel. So this ST segment, now the ECG here, you can see the ECG here, this ST segment more lengthy and T wave become more prolonged. So full interval here, this is your full QT interval. This QT interval, because the potassium channel you block here, so repolarization become slow. Repolarization become slow. The velocity of repolarization slow now. So here QT interval, Q R S and T. This QT interval, you can see the length here. This QT interval not much lengthy as compared to here, from ST segment till T wave. So if this happen, QT interval prolong, then can lead to arrhythmia like this. It's your torsade D point. Torsade, torsade D point. This torsade D point can change to VT, and this already VT can change to ventricular fibrillation if you develop torsade D point. Understand? If you develop torsade D point, it can lead to ventricular fibrillation, life-threatening arrhythmia. This is the very big side effect of class 3. Understand? What is the side effect of class 3? QT interval prolonged. QT interval prolonged by class 3 here, antiarrhythmic drug. If you remember previous drug, The QT interval prolonged by tricyclic antidepressant. QT interval prolonged by SSRI. Yeah, QT interval prolonged. The QT interval prolonged by SSRI. QT interval prolonged by tricyclic antidepressant. QT interval prolonged by amiodarone, sotalol is a class 3 antiarrhythmic drug. QT interval prolonged by quinolone. QT interval prolonged by macrolide. There are many drugs there they prolong the QT interval. Okay, so if you prolong the QT interval, what happens with your heart? The prolongation of QT interval, QT prolong, it lead to torsade D point. If QT prolong, it will lead to torsade D point. Can you tell me which class belongs to one can cause QT prolong? I want to check your previous knowledge here. Which class can cause QT prolong from class 1? If you remember that key point about 1, class 1, which group can cause QT interval prolong? 1A, 1B, 1C. Anyone?
1A.
1A, 1B, 1C.
1B.
Any other third person said 1C, yeah? At least one answer there. Class 1A act like class 3. Can you remember that point? Class 1A act like class 3. Yesterday lecture. Class 1A act like class 3. If class 1A have ability to block the potassium channel, so it can cause QT interval prolong. Understand? From all the antiarrhythmic, we have 4 classes here. Which drug can cause QT interval prolong? 1A and 3. Understand? Why 1A? Why you not go for 1B or 1C? Because they are not they are not a potassium blocker, they are just sodium blocker. So 1A have ability to block potassium. Understand? They have ability to block potassium channels. They have ability to block potassium channel. If I draw a picture for 1A, you can see the difference here. This is zero phase. All the drug, for example, it's a normal thing here. All the drug 1A make this slope more slow. Okay, this slope more slow. This here 1B. Okay, another 1C make this slope more slower. This here 1C. What is the picture of 1A? What happened in 1A? You can see clearly here. This here 1A also make slow this here zero phase and also act on phase 3, also make slower this. Can you see the big difference here? Also act on phase 0 because it's your sodium blocker. Class 1A also act on potassium channel, so also interfere with phase 3. Phase 3 also becomes slow. Understand? Class 1A act like class 3. Quinidine, disulfiramide, procainamide. Okay, quinidine, disulfiramide, procainamide also act like. What's the difference here? You can see the other classes. Other classes just affect 0. Just affect 0. Class 1 interfere with 0. Also you can see also interfere with 3. 3 also become more slow. Oh, a big action potential duration here. Yeah. So that's why class 1A, the more chances class 1A causing QT interval more prolonged. This interval prolongation not done by 1C, not done by 1B, because only class 1A have ability to block potassium channel. Understand? It's an extra function. What's the class 1A? Is your real sodium blocker. The main thing is a sodium blocker, yeah. But the extra thing here, the extra action of this class 1A also have ability to block potassium channel. Understand? So from all the drug, antiarrhythmic drug, how many classes there? We have class 1, we have class 2, we have class 3, we have class 4. How many drugs they causing QT interval prolong? Let me know. QT interval prolonged by which drug? This is
3
done.
and
Yeah?
1. Yes.
Okay. From one, which one?
1A.
Must say 1A, okay, not just full one. 1A, 1B, 1C, they have no relation with this QT interval. Understand? So from the antiarrhythmic drug, procainamide, disoparamide, quinidine from class 3. Class 3, we having two drugs, a amiode drain. Iode. Why putting here iode? Because in chemical structure have iodine. If this drug have in chemical structure iodine, what doing with you? Have iodine. It interferes with your T3, T4. But the side effect of amiodarone, side effect of amiodarone, the side effect, hypothyroidism, hyperthyroidism. It can cause, like if you use amiodarone, it's mean you putting some iodine in your body. Understand? We're discussing here class 3. Now the class 3, what the side effect of class 3? Number one side effect of class 3, amiodarone, the side effect here, hyperthyroidism or both, sometimes hyper, sometimes hypo. Understand? Hyperthyroidism and hypothyroidism. Another side effect, just now we finished, QT interval prolong. If QT interval prolong, what happens? Torsade. What happened? Torsade D point. This is very fatal arrhythmia, okay? It's very dangerous arrhythmia. Torsade D point. Understand? Okay, another side effect. QT interval long, this torsade. Done. The amiodarone is very strong, it's a hepatotoxic. Amiodarone, very toxic. Okay, amiodarone also causing phototoxicity. Photo mean light, yeah, toxicity. If you eat a amiodarone, take a amiodarone, then patient now in sunlight, what happens? Skin reaction start, phototoxicity. Okay, another reaction, what happened with skin? Skin color change blue, skin discoloration, clear? Skin discoloration, understand? Skin discoloration change to blue. Photosensitivity, hepatotoxic, QT prolonged, hypothyroidism. This amiodarone enter your lung and never come out of lung. Pulmonary fibrosis, start fibrosis. Oh, very big problem here. Pulmonary fibrosis. What is the half-life of amiodarone? 3 months, 80 days. You inject, for example, 100 mg of amiodarone in patient. 50 mg, the dose till 50 mg going after 3 months. Understand? It's 80, not till 3 months, almost 30, 60, 90, nearly 90 days, 80 days, nearly 3 months. Okay, so it's a half life. That's a big problem with this. So this amiodarone, why amiodarone is not going out? Why amiodarone not going out? What is the problem? Amiodarone bind with plasma protein. Which plasma protein? Your blood is very high concentration, albumin. Yeah. So amiodarone attached with albumin. So if you attach with albumin, can you metabolize that drug? If you attach with albumin, can enter to liver cell? Of course not, because drug already attached with albumin. Understand? So amiodarone bind with plasma protein. class 3. Another drug is sotalol. Okay, from class 3, sotalol. Sotalol. Sotalol and amide. Sotalol actually beta blocker. Okay, but also act like, but we put in class 3. Understand? We put in class 3. So if you want to use amiodarone, you must perform what? PFT. Patient must have healthy, listen here carefully. Patient must have healthy lung. Patient must have healthy liver. LFT must be good. Patient must have healthy kidney. Everything must be 100% working, then you can remove a mild drain. Understand? If you have lung disease, you already have interstitial lung disease and you're using a mild drain, what happen? More fibrosis. If you already have liver problem, using a mild drain, can you mild drain already problem with metabolism? Yeah, you have liver problem. Can you remove a mild drain? Now a mild drain may remain in your body for 6 months. Understand? May still remain in body for 6 months and producing what? Producing side effects. Disturb your thyroid totally because amiodarone having iodine. Yeah. Sometimes iodine too much go inside the thyroid gland and producing lot of T3, T4. Sometimes block thyroid peroxidase and no thyroid, no T3, no T4. It can cause hyperthyroidism. It can cause hypothyroidism. Understand? Hypothyroidism, hyperthyroidism, phototoxicity, hepatotoxic. Okay, phototoxicity, hepatotoxic, biliary discoloration. From antiarrhythmic, the important class 1A, and third is class 3. These two group very important, okay, for examination of point of view. Understand? It's all about class 3. Okay, now let's last class is your class 4. Class 4 calcium channel blocker. Which calcium channel blocker you will use for cardiac arrhythmia to decrease heart rate? These calcium channel blocker must be cardioselective. Diltiazem. And the last one is your verapamil. The side effects you already know. I no need to explain here. Okay, so a calcium channel blocker for what category of arrhythmia? If arrhythmia due to conductive system. If arrhythmia due to conductive system. AV node re-entrant sinus arrhythmia or AV node re-entry current of from the AV node. AV node re-entrant tachycardia. Sinus node problem. AV node problem. Tachycardia due to nodal current. So you can use calcium channel blocker. What is the contraindication of calcium channel blocker? One patient come to you having arrhythmia plus heart failure, sign of heart failure, pulmonary edema, sign of heart failure, ascites, sign of heart failure, body edema. Calcium channel blocker are contraindicated in heart failure, must keep in mind. Okay, calcium channel blocker, patient have arrhythmia, not use calcium channel blocker that time. Okay, calcium channel blocker are contraindicated in heart failure. Calcium channel blocker used for ischemic heart disease. Calcium channel blocker used for hypertension. These two things we can handle with calcium channel blocker. Okay, calcium channel blocker you can use for arrhythmia, but if patient have the sign of heart failure, then you must avoid. Understand? So what are the side effects of verapamil and diltiazem? Constipation, flushing of skin, gingival hyperplasia. Remember? Gingival hyperplasia, verapamil, peripheral edema, peripheral edema after eating calcium channel blocker. Okay, so calcium channel blocker causing flushing of skin, cause constipation, flushing of skin, constipation. Peripheral edema is very important side effect. Number one. Another side effect, gingival hyperplasia. Another side effect, prolactin. Gingival hyperplasia and peripheral edema, not forget about verapamil. Okay, the side effect of verapamil, gingival hyperplasia and peripheral edema. So the peripheral edema is also very important side effect. Okay, also very important side effect of calcium channel blocker. This is all about antiarrhythmic drugs. All about antiarrhythmic drugs. Okay, class 1 we've done, class 2 we've done, class 3 we've done, class 4 we've done. Class 1 act where? 0 phase. Class 2 act where? 4 phase. Class 3 act where? Third phase. Class 4 act where? 0 phase. Where? On conductive system. 0 phase on conductive system, not here. Okay. The class here, class 4 can act on 2 because in 2 what happens in myocardium? Calcium influx. Myocardium, calcium influx. It can decrease the plateau. Okay, it can decrease the plateau. Understand? So it's also act on the important thing here on conductive system. So class 4 we use for any type of conductive arrhythmia. It's the arrhythmia due to conduction. The class 0, 4, here this is 3, 3 act on 3, 2 act on 4, 1 act on 0. Understand? This your sodium, this your beta blocker, this your potassium blocker, and this your calcium channel blocker. Understand everything about antiarrhythmic drugs? If we further divide to 1B, 1C, 1A, and 1B, and 1C. Okay. The important you need to memorize is class 1A important here and 1B important here. Okay. For post MI arrhythmia, 1B, and you must use digoxin with 1A. 1A causing heart failure, SLE, and synchronism. Okay. 1C can cause cardiac arrest. Never use in MI. Never use in MI for 1C. Understand? It's all about antiarrhythmic drugs. Have any question? Next
No, sir.
lecture, from the heart. The remaining thing left. Antihypertensive, very easy. We will discuss when we summarize everything. Alpha blocker, you already know. Just one thing left, diuretics. Okay, then we can summarize antihypertensive. Alpha blocker, beta blocker, RAS blocker, you already know. Calcium channel blocker, you already know. So we can use all these drugs to treat hypertension. Okay. So this is not a big deal. The important drugs left for heart or severe system. One is your diuretics class, another drugs for LDL and drugs for anti-hyperlipidemic drugs, and third group anti-clotting drugs. Okay, these three things left. Tomorrow we'll go for hyperlipidemia, the drugs for lipids. Okay, tomorrow inshallah.
Really.
Okay. Assalamu alaikum. See you tomorrow inshallah.
Waalaikumsalam, sir. Thank you, sir.
Welcome. Allah Hafiz.
Shukriya, sir. Allah Hafiz.
Allah Hafiz.